Well, welcome everybody to Breaching the Boardroom. I am your host, David Mauro, and in the studio today, we're very honored and excited to have Brian Schroeder, a founder and CEO of a phenomenal healthcare application, and his company is called Preventia, and we're going to hear all about it. Brian, welcome to the studio, sir.
Hey, thanks for having me. Glad to be
Hey,
here.
great to have you. So tell us about your current role. Tell us about Preventia, and then we want to peel back the onion a little bit and find out kind of what led you to make this initiative, what led you to start an entrepreneurship and to focus in on telemedicine.
Well, as I said, great to be here today. It's a pleasure getting to know you a little bit before the show, and
Yep, always
the
fun.
interesting that we're in the same location, pretty
Yep.
close to each other. Not always the case when you get together with somebody via podcast. So, but anyway, yeah, my name's Brian Schroeder, and current role, I serve as founder and CEO of Preventia, where we focus really intentionally on management of habit, behavior, and mental well-being. Very much in the wellness space. But before doing this, I was not so much in the well care space as I was the sick care space. And you and I have talked about that a little bit before, and I'm sure we'll dive deeper. You know, this entrepreneurial journey has been absolutely crazy. If somebody had told me that I would be a health tech founder when I was working in sick care, I would have said you're a liar. And sure have learned a lot in the last number of years and love talking about the journey, entrepreneurship, and looking forward to dive in a little bit.
Excellent. So let me ask you this. So from a high level, there really are two kind of theories to taking care of the public's health here in the United States. And you aptly coin it, and I don't know whether it is like an industry term because I've been involved in the technology and cybersecurity space within healthcare for 15 years or so, but I haven't heard practitioners say like, well, I focus on sick care
Yeah.
versus, but I do hear a lot of people in the wellness space call it that. So that's why I wanted to ask. So sick care is really the pharma approach, the diagnosis and the focus on the symptoms of an illness. Is that
Yeah.
fair?
Yeah. Super
Yeah.
fair. I
And
would say it is.
wellness is really focused on prevention in the first place.
You got it. You
Right.
got it. And it certainly is an industry term. You know, when I was in big healthcare, we would refer to healthcare sometimes as
Sure.
sick care.
Yeah.
We call it healthcare, and it's barely even health.
Right.
So let alone sick care.
Yeah.
And you'll hear people that are in wellness, as you mentioned, they will refer to it as well care
Right.
versus sick care. And it's not so much that we're really talking about a philosophical approach to healthcare and what it really means. What are hospitals motivated by? Where do they make their revenue? You
Mm.
know, a lot of those that are in the wellness space, they'll go into healthcare and they'll get very excited about the work. They'll really look forward to diving deep into prevention, and they'll make the assumption that everybody's rooting for them. And that's not always the case in healthcare. Not everyone is
I
rooting for
wonder
your
why that
success.
is. I
That's right.
wonder why that is.
That's
Did it
right.
have anything to do with the old theory, in cybercrime and in cybersecurity, we generally follow the money. And if you follow
That's
the
right.
money, you follow the motives and the modus operandi of the activity leading up to it. And
Absolutely
from
right.
my experience, it's very similar in healthcare.
That's right. I put a post out on LinkedIn the other day, and it alluded to something along the lines of healthcare is broken, right? That's what a lot of people say. Healthcare
Yeah.
is broken, but it's actually not. It's operating exactly how it was
How it's
designed
designed
to
to
operate.
operate. Right.
Yeah. So
The
our
design is
approach,
broken, perhaps. Like
very
perhaps
much.
the design could have been better designed.
That's right. We have a lot of doctors that are trained to diagnose and treat, but they are
Correct.
not trained in the management of habit, behavior, and mental well-being. So what you'll see if you're diagnosed with heart failure, like my wife was, I think I shared with you previously, back in 2013, she was given a pamphlet, and some information on here's what you need to do, go eat healthier, move more, and stress less, and good luck, right? So we're not
Hmm.
designed to actually help someone like her get better and succeed. So yeah, it's a crazy system.
Walk us through your journey and how you decided to become an entrepreneur. I know it was a very personal. I found it moving. Your wife, who's young and relatively healthy, all of a sudden was stricken, and it kind of inspired you. Like,
Yes.
are you willing to share that with the audience?
Absolutely. You know, it's
Thanks.
a it seems like it would be a sad story, but it's not. It's a
Right.
story of perseverance, both professionally and personally on my wife's side. I was working in big healthcare, as I mentioned. I'd done everything from pediatric cardiology to managing, labor and delivery units, OBGYN practices, really primary and specialty care for mostly underserved populations. That was
Mm.
the majority of my work. So I was running big hospital practices. And an opportunity came along right around 2013 when, at the same time that my wife was pregnant and was nearing the end of her pregnancy and then gave birth to my daughter. And when she did, she was diagnosed with cardiomyopathy, which is otherwise known as heart failure. So her heart was pumping at about 15%. Ejection
Mm.
fraction, a normal human is about 60%. And she now had this new diagnosis that she had to learn to live with and how to manage more effectively. Now, I was literally in healthcare and I had all of these connections to people where I could help her get appointments and stuff, but I didn't really know how to help her. Well, right about that time, I met an old friend that I used to work with at Eskenazi Health in Indianapolis, and she said, "Hey, there's this wellness thing coming up." At the time, I was heavy into CrossFit, and she knew that. She's like, "You're kind of a wellness guy." I'm like, "Wellness? What the heck is wellness?
Yeah, you're like,
I
I
don't
don't
even know
know.
what
Is
that
it
is."
vitamins? Is it shakes?
Yep.
What am I supposed to do?
Yeah,
Right.
which is crazy because I feel like I've been doing it my whole life now. But
Yeah.
career-wise,
Right.
I was interested, and really, it was an opportunity to be an entrepreneur and to go into a large health system and innovate, work with population health teams, test different solutions, see what worked and what didn't. And, recognizing and doing that, the fact that my wife had just been through this diagnosis, I
Hmm.
wanted to dig deep into it. So I decided to get out of what I'd been doing and take a leap of faith and go do this. And what a learning journey, seeing the other side of health, really the complete other side of healthcare, and being able to actually make an impact on patients' lives was incredible. But again, our systems are not set up for this type of
No.
care. So, as we began to have success, the greatest part about it was that we were generating patient outcomes. But the worst part about it is that we were generating patient outcomes, but we
Right.
couldn't scale it, right?
Right.
So, I started thinking if doctors are, as we mentioned earlier, if they are truly trained to diagnose and treat, who is it that focuses on the habit and behavior, right? How do I hire more of those people?
Right.
Well, that's never going to get approved because those services aren't usually reimbursable. So you see, the light, you understand that you can actually make impact, but you have to step outside of the walls of the hospital and go find another way to get it done because it isn't going to get done within the walls of the hospital or that system. Valiant efforts are out there every day and there are amazing people doing amazing things, but it's not going to happen. My wife adopted this approach. I don't want to leave this piece out just because I often do and I
Y-
forget to say my wife changed her habits, her behavior. She slowly
Right.
started to get better. And last year, her cardiologist told her she no longer even has heart failure. So that's been about 10 years in the making, but
That's so
change is
personal
possible.
and it's so important because it kind of creates the foundation for your new trajectory in your career. So, I
Yes.
mean, there's deep meaning to it, and I respect the fact that you share that with us. That's excellent. Question: not only is that an inspirational story, but my question to you is: prior to that diagnosis, what type of wellness consultations had she been given from her healthcare providers? Because that, to me, is the void that Preventia solves, right? It's one of the
Yeah,
voids, right? It's one of the
that's
things.
certainly that is the
I
void.
was I was just curious, did they do anything other than, I just know from my personal experience and my family's, when we go to the physicians, they will ask, you smoking, you drinking, you exercising, like just asking questions. And so long as the answer is generally positive, if it's negative, then obviously they say something, slap you, just say whatever. But in general, it's more, encouraging, but that's about it.
Yeah.
Right. And then a lot of people say what they want to say to their doctors, and then they go about their merry way. So really, there has to be a lot more to that. And I'm a huge fan of telemedicine and being able to, because so much of it can be done and arranged and consulted in a more regular fashion when it's less intrusive and less inconvenient, like waiting 5 hours for a 15-minute appointment for a physician, right?
Yeah. Yeah, I would say her journey is not unique, first of all.
Mm-hmm.
I think that's
Clearly.
important to recognize.
Yep.
We as a family have the resources for her to get good care, right? It's
Mm-hmm.
financially we're blessed enough to have those, but you got to think about people that are like her, people
Yep.
that don't have those resources, that suffer from different social determinants or social influencers of health, where maybe they don't have the transportation or the financial means
Right.
to be able to do this. Now, when she was diagnosed, that it was at a time where telehealth was on the rise, but COVID had not hit yet.
Oh.
The virtual care component of this hadn't exploded the way that it was. So for her, it was a here's your condition,
Mm-hmm.
here are the things that you need to do. And this is usually the doctor, and her cardiologist is great. But once again, diagnose, treat, habit and
Right.
behavior over here. So it was a referral to a dietitian. And back then, before telehealth, the access to that dietitian was quite a long time. I think we waited 3 to 4 months to even
Really?
get her appointment. And it's not about diet, it's
No.
about all things related
Right.
to habit and behavior. That is just one component to it.
Sleep, exercise, diet, nutrition, all of it combined.
Mental health,
Mental health.
coping,
Right.
and you mentioned earlier that, like someone like my wife or really any patient, when a doctor tells you that you need to make these changes, everybody kind of knows. Like people that don't
Mm-hmm.
have her condition or haven't been diagnosed, even, everybody knows you need to eat healthy, move more, and stress less. But there's this little thing called self efficacy. And that is like, do you really know where to begin? How
Right.
do you start that journey? What do I do? And that's really what coaches help people understand. They're the compass, they're the guide to help you look forward and into the future. And that's not the type of care that was available to her at that time.
So walk us through. You created Preventia. It's a mobile app available on Apple,
Yep.
Android devices. You aren't a coder. I imagine you don't know Manage Engine or whatever they code Apple apps in now. I mean, there's a whole host of, there's like 5 or 6 different languages that they do. Not that hard if you know it. I don't know it. I just know people that know it. And
Hmm.
so that's quite a feat just to create an app and put it in the Google Play Store. Pretty easy. Like my kid could do it. Creating an app, no offense to Google, but it's just kind of the standards are a little bit lower. Creating an app and getting it in the Apple Store, big deal. Big
Yeah.
deal. Have to have security around it, privacy features, all of that. They're very, very picky. It's very hard. And you did that. Congratulations. That's phenomenal. Walk us through what it does. Walk us through the benefits to the users.
Sure thing. The first thing I would say is I would have never thought I was going to do that.
I know it's
And I
not
didn't.
something you, yes,
I led teams that
good.
built these
As a
technologies.
true leader does, right? Like
That's right. I mean,
that's
you have to
good.
know what you can't do. There was no way
Correct. It's
I was going to
exactly
do it.
right. You'd be
So,
surprised how many try and do a little bit of all of it, and it's
oh
not
yeah,
right. Yeah, it's
yeah,
not
that's
good.
right. And there's many ways to get this done, but the first
Mm,
thing is to recognize that, you know, when we talk about it being available in the App Store, it's actually a web-based application and both
correct.
available in Android and in Apple or in iOS. So you have to be able to develop something for everybody, right? So
Correct.
you have to be agnostic in your platform and in your journey. But the main thing is we just knew we had to have a technology that would, if you think about the lack of scalability of the model within the walls, it wasn't about the technology. It was about extending the reach beyond those walls and finding practitioners that are out there. And there are over 150,000 health coaches in the United States that are certified
Wow.
How do you find them though? These coaches are actually all very entrepreneurial themselves. They want to
Yeah.
stand up a business. They you'll see them leasing something in a strip mall, or they're part of a functional or lifestyle medicine doctor's practice or something. They don't really love going and working inside of those walls where they're like the redheaded stepchild. They
Right.
want to build a
It's a
business.
great point. So
Right.
how did you meet that challenge?
Well, there are very amazing organizations out there that actually certify health coaches. And they're part of the NBHWC, which is at the top. That's the National Board for Health and Wellness Coaching. Then there's these accredited programs underneath that that all certify health coaches. And it's sort of a very controlled environment where we know your modality of training, we know how you're trained, the quality of that training. But very much like Uber, how do you build a whole new gig economy around this, right? Like, is there a
Right.
way, because the scale is such a problem, is there a way to build a technology that wraps its arms around that whole community of care providers? And then, much like Uber, they had a car, they had somebody that needed a ride. How do we build a technology that brings those two people
Connects
together?
the two of them.
Same thing, same thing.
Right.
You have people that have been recently diagnosed as cardiometabolic co-prevalent, and you've got people over here that can help you focus on that: eat healthy, move more, stress less. But where do you find them? I
Was
mean,
that
you
the
could
medical
search.
term for that phrase? I was just curious. Like, was that the actual the English translation for that phrase? Because it
It's
sounded
mine.
very serious. And then it's like move more and, stress
Yeah.
less. I'm like,
The
okay, we can all use
cardiometabolic
that.
would be you have diabetes, you have
Right.
heart disease, you have whatever
Right.
you have, and you're going to need to change everything
Yeah.
you've known, most likely. If you can't find these people in the health system that's part of your cardiologist's practice, or you can't find them on your own, how do you find them?
Right.
And when we founded this
Well,
company,
they're
health
not
coaching was
promoted
not as
within the
mainstream.
system though either. I find like people have health insurance and they might see when they first get it, or if if your company that you work for shifts health insurance, you might see that there's certain things that are available for wellness or for whatever, but that's it. Like after you put that flyer away, you don't ever hear, there's no reminder, there's nobody out there touching you, reminding you, and then your own practitioners never mention stuff like that.
That's right.
So it's really good that you're out there driving attention to this.
And for the self-funded employer
Oh yeah.
who is on the hook for any of these conditions that come up, right? They're self-funding the insurance plan.
Oh yeah. It's much better to
Yeah, what do you
focus on
do?
prevention.
That's right.
It makes sense, economic sense clearly, but also just from the quality of people's lives. Like it
Yes,
just
sir.
really, really is the future of healthcare. It's just a matter of, making it mainstream, making it more accessible.
It is the
So
future.
how do people get involved? Do they subscribe to it? Do they work?
Well, we thought about that in the initial stages. It was, do we take this direct to consumer and it's just an app that you would
Yeah,
put
I
on the
mean the
app store?
model's
And
yours to build at the time, right?
yeah, yeah,
You
but
can
it's
you can do it a whole bunch of different ways. And then
mhm.
does insurance tie into it? I'm just thinking of all the things that a regular patient would ask.
Yeah, it would be great to be able to offer it straight to the public, and there is probably even a time for that to actually pivot and maybe do that. But the best way to do it is to go and work with those that really have
Employers.
that interest, the
Yeah,
employers, and sell directly into the employer space, knowing that they are at risk for these conditions. They are at risk if somebody moves from, not having diabetes to pre-diabetes and then to full-on diabetic. And we really started with that approach. And then the other market segment was healthcare. That's where I came from.
right.
And I launched this company in 2017, but for 2 years, it was really just kind of in development. So when we took it to market, I took it to market in Q4 of 2019, which was 1 month
Right.
before a global pandemic. So you didn't get any, we had no attention from the healthcare delivery systems at
Right.
all. So we worked with employers to kind of get it out there. And there may be a time where you go direct to consumer, but that time is certainly not.
But it clearly makes sense going to employers. Like it is a value add for the employer's culture, right? It shows that the employer is empathetic. It's really good. It's a great political move, like
Yeah.
for culture and for everything else. Plus, it really makes economic sense for everybody. right?
especially for culture.
Yeah.
You want to be a well place to work. And, this wellness industry is massive. I mean, it's such a
Hmm.
massive industry, and there's plenty of wellness technology out there that focuses on things like challenges and incentives. You probably heard people talk about the Walk to the Moon challenge or like
Hmm.
whatever it is. But at the end of the day, what people want is human connection. They want
Right.
to be able to connect with another person when they're
Anywhere,
having these issues.
anytime when it's convenient for us. All right. Like that's really it's a big ask that people
Yeah,
have, but
yeah.
that's really what they're looking for.
And technology allows for that, and it,
Yeah.
it did it didn't always.
Right. So they're able to connect straight to a wellness. Do you call them wellness coaches? Are they're certified clearly, but I mean, are they called wellness coaches?
Yeah, I mean, you people refer to coaches as many different types of
Hmm.
coaches, but at its core, it really is, wellness coaching. But the ability to be prescriptive is what's
Hmm.
important. So this is what I love about the coaching community. They're always taking it to the next level and learning something new. So within wellness coaching, you've got some subspecialties like mental wellness coaching
Right.
that focuses more specifically on mental health. You've got lifestyle medicine coaches that sort of follow that American College of Lifestyle Medicine framework. A new evolution right now that is super hot because it's a big both problem and solution is GLP-1 coaching, which is weight losses. So your
Absolutely.
Ozempic and Wegovy and all of that. And new studies have come out that show that yes, you're going to lose weight on the drug, but 70% of people will actually gain all the weight back if they don't pair it with a coach who's going to teach them habits and behaviors. So
Right.
lots of these different types of modalities are out there, but it's hard once again to scale that. Like, what if you just had two health coaches on site at the employer and they're trained in whatever they're trained in, and you got people with all kinds of different needs? They can't
Right.
meet the needs of those people, and that's why the health systems can't do it. So there's
Hmm.
many reasons for it, but coaches in general are multidimensional for sure.
Yeah, I love it. And I love the focus on prevention. So, question I'm just thinking, what questions would potential users have? Do you keep my data safe? To get it in the Apple store and to get it rolled out at some of the big universities? I saw, I think LSU, Louisiana
Yeah.
State, just
Hmm.
congratulations on that. I
Yeah,
just
thank
saw
you.
that partnership that was on social media. That's phenomenal. What a great institution.
Yeah, I appreciate that.
How do you guys, I assume it's built and the data is at least kept on servers here in the United States. It's not a Chinese app or anything, like, because I always hear people complain about TikTok, stuff like that. No issues like that, I imagine, because it's healthcare.
Yeah, I mean, you have to build these technologies in order to even work with, like, let's say an LSU or especially a health system.
Right. That's what I
I
was
mean,
thinking.
just table stakes is that you have to be HIPAA secure.
Right.
So it's going to have to be secure from an information standpoint, per PHI, personal health information, SOC 2 compliances, HIPAA security, all of that. I could
Hmm.
get into that and pretend to be the tech engineer that I'm
No,
not.
it's fine. Just as long as you
Yeah.
thought about it, and people can know
Yeah.
that that they're secure if they use it.
Yeah,
Right.
completely locked down and secure, or we wouldn't even have the opportunity to work with the types of groups that we do.
Excellent. That's outstanding. What other organizations are you guys in already? Are you free to say that? I mean, or things that are public anyway?
Actual clients, probably not too much on that, but I mean, it's
Yeah.
safe to be able to say that we work with and have worked with a variety of types of clients. And the reason that's important is because, not all of your listeners have probably heard the term population health, but at the end of the day, that's what Preventia is. It's really not so much even a wellness solution, it's a population health solution. So you can look at any large population. There's a county here in Indiana that we've been working on a project with for a while where the veteran population is at heavy risk
Very
for
high.
access to mental health, right? And they
Yeah.
could certainly benefit from management of habit, behavior, and mental well being. So you might have community based programs that are backed
Hmm.
by different health systems and they're all sort of collaborating. And we come in as the population health solution to help them scale so they don't have to do it all themselves. It could be a large university like Butler University that we've been working with here in Indianapolis for the last 3 years, or someone like LSU, where there's a completely different focus. It could be an employer that has a heavy, well, my first employer we ever worked with, 75% of their population was going through prison reform. So they had very specific social determinant
Interesting. Sure.
needs. How do you work with them? Well, not just anybody can work with them. You might need
Right.
recovery coaches that focus on substance abuse, right?
Hmm.
So basically, what it's really about is we're agnostic to any type of population. As long as there's a population that's defined and that's at risk, you look at that at risk population and you evaluate what their needs are, and then you customize the care for that population, knowing that you can scale it. So, really, that's where the rubber meets the road.
Absolutely fantastic. So, what were some of the when you were growing up? I was like asking this. Like when you were growing up, there is no way you were like, I am going to create an app. I've got this. Like that was not the thing back then. It was not, we weren't thinking about apps. We weren't thinking about, focusing on the wellness. I assume back then your wife's event clearly altered the trajectory and inspired you. So what were you going to school for? What was your view when you were younger? And then what had it like changed the trajectory? I mean, it seems like it was your wife's event and your drive because your own health and your own expertise in athleticism, etc., that kind of was having you focus on there's got to be a better way to approach this.
Um,
That really
Trying to
wasn't
think
a
of a
question, but I think you know exactly what I'm asking.
no, no, it is.
Okay.
I appreciate the way it's framed and the
Okay.
opportunity to speak to it because it's important. If I'm trying to think of it like if you asked my parents,
Right. That's what I always
what's
get to.
Brian going to be
Right.
when he gets older, they would have said he's going to be a nonconformist
There you go.
because I was challenging the status quo from a very early age, including making the bus driver show me in the manual where it said I had to keep my window up, right? I got in trouble for that. But, if you think about later in
Stirring the
life,
pot
it's always,
constantly. Ah, the poor
always,
bus drivers and
I know.
teachers.
That's a true
Ah,
story that my parents
yes.
tell me.
Oh
But as I
my.
got older, when I was 14 years old, my brother was killed in a car accident.
I'm so sorry.
And yeah, thank you. It's been a very long time, but my brother Nick was killed in a car accident. And many years after that, I had an opportunity to intern at Riley Hospital.
Mhm.
And it was for the Department of Community Education under a woman named Karen Stroop, who gave me an opportunity to focus on sports injury prevention. And a
Oh,
lot, a lot of that had to do with bicycling because he was killed in a cycling accident. And it just got me thinking about how might I go about helping people. Now, I was already at Indiana University studying business and public health, really kind of for those reasons. But it was through the work at Riley Hospital when I was learning about that I could actually do this for a job that I decided to go to grad school and get a master's degree in health administration. And so I've always been interested in healthcare. Didn't know that I was going to be an intrapreneur turned entrepreneur
mhm.
afterwards, but not surprised. Put myself through grad school by starting a swimming pool company to clean pools in the summer and make money.
Phenomenal.
So that was like my first entry kind of into entrepreneurship even back then, but I never would have thought I'd end up here doing this work.
That's phenomenal. That's a phenomenal story, and I always find people are in certain fields because of some event, right?
Yeah.
Like the cybersecurity community, I know, saw so much interest post 9/11, just like our regular armed forces did. So it's very, very meaningful to me. That's great. So as we wrap up, what is on the horizon for Preventia? What is your 2025, 2026 outlook look like? What are you shifting gears? You have certain targets you're trying to hit?
Yeah, I think right now it's about having successful implementations, working really hard on some case studies. I'm very interested in the GLP-1 phenomenon because it
Oh yeah.
actually
It's a
works.
huge social experiment almost, isn't it? Because it's
It
like a
is.
drug that was originally for diabetes is now being pushed out mainstream
Yeah.
with generally positive results depending on who you ask. some side effects. I mean, it's going to be interesting to see
Yeah,
what
you're
10
almost
years
certainly,
later it looks like.
for sure, and you're almost certainly going to lose weight on these
Hmm.
drugs. But the key here, the part that I find fascinating is that, yeah, it does work, but the sustainability is still an issue. And when
Right.
people, are diagnosed with, let's say, diabetes, a lot of them are convinced that they're just doomed because it's hereditary. And you can't see the changes that are happening inside of your body as you make those changes. But when you're on a GLP-1 or you're diabetic and you've been struggling so long to even get started, maybe it's the little nudge you needed to see results that help make you convinced that maybe you can make a change. So there's a lot of intrinsic motivators here for this space that I
Hmm.
find to be fascinating. And people are terrified they're going to gain this weight back. So for me, it's about you know, getting this out there as much as possible for populations who need it, but making sure that it's sustainable and studying that. So on the horizon, there will be a lot of that, hyper focused on growth, of course, as well.
Yep.
So there will be capital raises in our future very, very shortly and looking to expand the team. But mostly it's about expanding impact and access to care and hoping we can do that well.
That's phenomenal. Well, Brian, we wish you all the best. We will have links to Preventia and to your LinkedIn in the show notes. And we thank you so much for your time today. We wish you all the best. What you're doing is phenomenal. It's just, I know I keep using that word, but it's so true. Like you really are. It is so deeply needed in healthcare today. It's very timely and relevant, especially given the Ozempic rush and how it's everywhere on social media and I'm always waiting for, but if you don't form the habits, like it could be, I think you're right. Like I think once you start seeing the weight loss, then all of a sudden it's like, okay, now if you just stop, you're going right back, right?
That's right.
It like,
That's right.
but now that you've got that kickstart, now develop the habits around that so that it can sustain, so that should you drop off it, you still have a healthy lifestyle and overall good mental health, well-roundedness that you're able to just keep that going.
You
So,
got it.
yeah,
You got it. Behavior change is possible, even as
yeah,
much as we think it's not. So I'm hoping to have a small part in that in helping people.
that's fantastic. Brian, thank you, sir. Thank you for your time. Thank you for your insight. We really appreciate it.
Pleasure. Pleasure to be a guest on the show today. Thank you.
Thank you, sir. Excellent work. Great job.